Okay guys, I am going to continue the second part of Inicet. Okay, the first question was regarding the tension pneumothorax and it was clinical based question, and the question was, it was like, a patient came to the OPD with the complaint of RD, that is respiratory distress, hypotension, that is systolic BP less than 90, and subcutaneous emphysema and absent breath sound on auscultation. Even sometimes you will find, on percussion you will find hyperresonance. Okay, so that will be the diagnosis of the tension pneumothorax. And what is the management of the tension pneumothorax? It's a two type. If the child will become, it will be the insertion of the large bore needle in second intercostal space in MCL, that is mid clavicle line, followed by ICD insertion in the triangle of safety. This will be in the case of child. But if the question is regarding will be the adults, then you have to follow ATLS update 2018. According to ATLS update 2018, fifth intercostal space slightly anterior to mid axillary line in adults. I repeat, fifth intercostal space slightly anterior to mid axillary line in adults. But in case of the child, second intercostal space in mid clavicle line, here mid axillary line. ओके, क्योंकि एडल्ट्स है तो आप माल बन जाते हैं, आप ऐसे याद रख सकते हैं. इन शॉर्ट ट्रिक, एडल्ट्स माल, माल एडल्ट्स. ओके, note, in case of massive hemothorax management, you have to, ICD insertion will be there, and there should be optimal size of the chest tube, that is 28 to 32 French gauge. Okay, now the question comes, what is triangle of safety? And even this question was already asked. The triangle of safety, anteriorly you will find pectoralis major, posteriorly you will find the latissimus dorsi, and inferiorly a line which is passing through the fifth intercostal space, and superior at the base of axilla. Look at this diagram here. Okay, if you see it in the front side, you will find the pectoralis major. Just feel it, where is your pectoralis major is there. और बैक साइड में latissimus dorsi है, और सुपीरियर में आप देख सकते हैं बेस ऑफ एक्जिला. ओके, बेस ऑफ एक्जिला, एंड inferior you will find a line which is passing through the fifth intercostal space. So this is the boundary of the triangle of the safety. Okay, note, this question has asked in EAMS, insert ICD over the superior border of inferior rib. I repeat, if the question asks where do you have to insert the ICD, so you will say it will be insert ICD over the superior border of inferior rib. रिब के inferior side में आपको बेसिकली inferior rib पे जाए, और उसका जो superior border होगा आपको वहाँ पे ICD को insert करना है. The second question which have asked in the Inicet part 2 2020. Okay, the question was like that, if the chest x-ray show the clear lung field, अगर आपको कभी भी चेस्ट एक्सरे को में आपको लंग फील्ड क्लियर दिखता है, तो व्हाट विल बी द नेक्स्ट मैनेजमेंट? विल यू डू द चेस्ट ट्यूब इंसर्शन? विल यू डू द CET abdomen? Will you do the CECT chest? No, you are not going to do anything. The answer will be E-fast, and E-fast is done for the 6 views, and apart from the 2 views, the very important, that is the thoracic injury. कहीं भी आपको thoracic injury दिखिए तो सबसे पहले आपने क्या करना है, you have to do the E-fast. Okay, E-fast, not fast. Okay, for the patient, if the patient comes stable, then without fast, बिना fast के we cannot go for the CT scan. आप बिना fast के कभी भी CT scan नहीं कर सकते हैं. So the basic concept you have to learn from here, in case of thoracic injury, the most common investigation for thoracic injury will be E-fast. Okay, and USG, E-fast is the USG which can be used to differentiate between contusion and actual purgence of the blood. Okay, it can be used to differentiate between contusion and actual purgence of the blood. So basically the most common investigation for thoracic injury will be E-fast. Now let's talk about the fast. Okay, this is the focus assessment sonography for the trauma. Okay, so it is done within 2 to 4 minutes, in the hospital only. So assessment in sequence. कि पहले आपने क्या करना है। सबसे पहले आपने क्या करना है, इन केस ऑफ फास्ट आपने 2 से 4 मिनट के अंदर आपको असेस करना है। ओके, फर्स्ट यू हैव टू लुक एट द हार्ट एरिया, ओके, दैट इज़ कॉल्ड द पेरिकार्डियम। आप हार्ट के चारों ओर देखें, उसके बाद जस्ट नीचे आए राइट साइड पे तो आपको हेपेटिक एरिया में जाना है, दिस इज़ नॉन द पेरी हेपेटिक एरिया। फिर सीधे आपने राइट से सीधे आपने लेफ्ट में जाना है, दैट इज़ द पेरी स्प्लिनिक एरिया, ओके। एंड द लास्ट यू हैव टू गो द पेल्विस। तो रिपीट विथ मी, द फर्स्ट you have to go the pericardium, and then you have to go for the perihepatic, and then you have to go for the perisplenic, and then you have to go for the pelvis. Okay, sometimes they can ask you what are the views you will find in case of pericardium, in case of perisplenic, in case of perihepatic or the pelvis. तो सीक्वेंस वाइज देखते हैं। सबसे पहले पेरिकार्डियम एरिया है, अब फील कीजिए पेरिकार्डियम पे, वहाँ पे सब जीफोइड ट्रांसफर व्यू मिलेगा, सब जीफोइड ट्रांसफर व्यू मिलेगा। In case of perihepatic, obviously liver is in the right side, okay, the right upper quadrant longitudinal view. So if you go for the left side perisplenic, then you have to do the left upper quadrant longitudinal view. In case of the pelvis, you have to go for the suprapubic longitudinal and the transverse view. So this question has asked how many views you will do for in case of pelvis. Okay, जब आप pelvis में आप चेक करते हैं तो you have to check the 2 views. First one is the suprapubic longitudinal and the transverse view. In the E fast, I have already told you that there will be the 6 views will be there. Fast 4 के fast के 4 और अलग से दो कौन कौन से, thoracic view, right thoracic view and the left thoracic view. So in case of fast 4 assessment will be there, 4 view will be there. In case of the E fast 6 view will be there. Okay, one for right thoracic view and another for the left thoracic view. Thank you.